Welcome, everybody. This is the Psychedelic Support Monthly Speaker Series. I'm your host, Dr. Allison Fiducia. Today, we're going to be exploring the balance between inner-directive and directive approaches in psychedelic therapy sessions. Many of you are probably familiar with the non-directive or inner-directive approach in psychedelic therapy, where the emphasis is on following the client's inner guidance. Today, we're going to learn about that, but also when it might be beneficial to incorporate a more directive approach. And I can't think of two better speakers than our guest today to explore this topic with us. First off, we have Kyle Buller, who holds a BA in transpersonal psychology from Burlington College, where he focused on studying the healing potential of non-ordinary states of consciousness by exploring shamanism, Reiki, plant medicine, holotropic breathwork, psychedelic psychotherapy, and dream shadow transpersonal breathwork, which I think we could do a whole episode just on that topic because I know nothing about it, but it sounds really interesting. Kyle also holds a master's in clinical mental health counseling with an emphasis on somatic psychology. He is a licensed associate counselor and offers psychotherapy services specializing in psychedelic integration, spiritual emergence, and ketamine-assisted psychotherapy. Kyle is the co-founder and vice president of education and training at Psychedelics Today, which offers the Vital Psychedelics Certification Program. I'm going to talk a little bit about this program after I introduce Dr. Sapiro, because there is a new session starting in September, and I would like all of you to be familiar with what this offering is. Next up, we have our other guest, Dr. Michael Sapiro, is an ordained Zen Buddhist monk and poet, clinical psychologist, psychedelic psychotherapist, writer, and meditation teacher. He is a fellow of the Institutes of Noetic Sciences and a core faculty in the Psychedelics Today Vital Therapy Training Program. He teaches internationally on the art and science of transformation, expanded human capabilities, psychedelic psychotherapy, and future making. He offers CAP, ketamine-assisted psychotherapy, to first responders, special operations, combat veterans, and community members. Also, we had Dr. Sapiro here a few months ago to talk about truth medicine and non-dual approach, which I'll drop the link in case you missed that one. It was such a great talk, and I was excited to have Dr. Sapiro back. Yeah, so it's wonderful to have so many of you join us today. We're going to dive into our session, and hopefully we'll have a little bit of time for some Q&A. I'm going to hand it over, but first I just wanted to mention the Vital training program. There's a new start date in September, and at Psychedelic Support, we only promote 2 in-depth training programs, and Vital is one of them because of the established leaders that they are. I have a lot of respect for what they've created at Psychedelics Today and this extension into the Vital program, because it is a very comprehensive curriculum. It's fully online, and you get a range of expert topics. It's also a program that enrolls both licensed health providers as well as other professionals, such as coaches or healers, that would like to take the next steps in advancing their knowledge and education with such a comprehensive, client-centered approach. So I will drop links in as our speakers start chatting here. Also, I welcome you all to say hello in the chat and where you're calling in from. We will share the video after, along with any links and resources that are shared during the talk. So if you missed something, you'll get an email after if you registered, which I think everybody probably did. All right, so thanks so much for being here. Turn it over to Kyle and Michael.
Yes, thank you so much for having us. We're really excited to be here. Mike, I'll toss it over to you because I know you wanted to start off with some questions for the audience.
Yeah, we want to invite you to participate with us. It's kind of the way we do it in Vital, really student-centered, engaged in how you think. We're here talking about inner-directive approaches where the client really and their own wisdom, intuition comes forward in the medicine, and maybe the facilitator, guide, or therapist kind of waits to see what happens and how to work with that. And there are other directive approaches where the therapist is much more engaged in the process. And this is a little bit of a newer approach for our field. And so we wanted to invite all of you to kind of think about what is your stance? What's your orientation toward inner directive? Do you are you a hands-off approach, or are you in their psyches working with them? And how might you work with them? So we wanted to see, and how do you define these approaches yourselves? So I'm going to let y'all kind of think about that. It's helpful for us as the kind of presenters to get a sense of where you're at and where we can go from that. Deep presencing and witnessing. Kyle, what are your thoughts on any questions for them specifically too?
Yeah, I'd love to hear if people are very familiar with that non-directive approach. I do have some slides we can go over it. I figured those that are showing up here are probably very familiar with that. But yeah, have you had any issues with that? One reason when we were thinking about putting this webinar together, I'm always kind of thinking about the evolution of things, maybe where some hiccups have happened over the years. And are there opportunities to evolve the practice? So we thought this could be a fun conversation to have.
Already I'm seeing a few alternate perspectives. Brad, you think a directive is effective, and how do you know that? What makes you think a directive approach is more effective? Somebody said they're using spidey senses. I love spidey senses. I work at Institute of Noetic Sciences, which we really talk about intuition, presencing, attunement. We talk about telepathy and clairvoyance. What happens when a facilitator or guide has clairvoyance or telepathy and can pick things up? Do we use it? Do we not use it? Here we go. Now we have a lot of awesome comments. Much more fans of inner directive. Let the medicine do the work. Good. I like this. Are most of us therapists here? I'm guessing that this is more of a therapist-oriented talk. Even if you're not a therapist, what's your approach when when you see the client having some fuzziness? Like, why is this coming up? What should I do with this? Or do you use Socratic questioning? Are you guiding or leading? Or do you just say, explore more? Like, what's your style? Inner-directive with IFS? Yes, right. Allison brings up, and we're going to talk about that. Different medicines might need different approaches. I know when I'm working with the 5, I'm not talking to them while they're, they've just taken their inhales, they're laying down. That's not a time for me to start leaning over and talking to them. Kyle, you seeing anything to address here?
Seeing lots of things. Yeah, I'm reading. I did see that somebody did say some clients do like a more directive approach, and I've had that too. And I think this is the reason why we wanted to have some of these conversations and talk about this topic today. And it sounds like a lot of people, relying on intuition, those spidey senses, respectful of the client's inner guidance, but can be flexible.
Dosing is also very important. Absolutely. So I work primarily I do a lot of different things, but one of the things I do is at a ketamine clinic, and dosing is extraordinarily important for the quality of consciousness of the client. So if they have a higher dose of ketamine, it's going to be definitely more of a psychedelic experience for them, and their verbal capabilities are going to be limited. And so that's not where I tend to work best. I tend to work in the psycholytic dose, where it's less psychedelic, but more we can consciously have conversations about things that are coming up with them. So what happens if a dose becomes psychedelic? I have to sit back because I'm not going to interrupt where they're at. I might ask some questions. So it might be the beginning and the end. We're doing psychotherapy, where in the middle and the high, where during their peak, I'm just helping them explore the psychedelic content that's coming from their subconscious or the cosmos, their psyche, wherever.
I think this is an interesting comment here by Brad. Clients are paying for your expertise. Give it to them.
Yeah, dude. I like that. I believe that too. I'm going to be pretty direct with you all about my perspective on this, because I do think the field is going to shift as this becomes more of a mainstream medicine or therapy. What are y'all going to be doing And who's training you to do what you're doing, or how are you learning to do what you're doing? Yeah.
I think there's some really great conversation in here around, yeah, the medicine and also the dosing. And, you know, does dose matter at times?
Mm-hmm. And again, depends on the medicine. Generally, no matter what dose of 5-MeO we might be using, we're probably not conversing. We're not going to do the psychotherapeutic. We might be space holding, witnessing. And I'll explain as I lift them up and I see them coming back to this reality. There's a way that I start asking questions because they're very vulnerable in that stage. So then I might use a small to a high dose of 5, but then I'm not interacting at all while they're on it, but they're still in that half state as they come sit up before they go to the next hit. Okay, great. Oh, I hope you're all taking some notes about things that everyone else is sharing here. There's a lot of good wisdom in this chat.
There's, I saw some questions in here around defining psycholytic, and maybe we could do that.
Mhm.
And then maybe I'll move into a little bit of slides. I know people do like to see some stuff on
Okay.
the screen, and we can get into some details. And then we'll try to save a lot of time for Q&A. I think there's a lot of richness in this discussion with Q&A.
Mhm.
Could you define psycholytic, Mike?
Yeah, again, so I'll think about it in terms of ketamine, at least. That's my primary medicine, what I do most of during the weeks. Psychedelic is when the state of consciousness may be altered to a place where the coherence and being able to chat openly and freely may be so disintegrated. So let's say the ego, the normal ego functioning state, or neurologically the default mode network is not online anymore. And so we're not going to be having coherent conversations. Psychedelic space might also be images from the cosmos or deep from the psyche are coming up, and they're actually in it rather than witnessing it. A psycholytic state, from my perspective, is one where we're in it. We can touch on the psychedelic imagery. We can touch on metaphors and symbols arising. But we're aware of it. We're still in a place of conscious awareness. Oh, I'm seeing, I'm hearing, I'm thinking, I'm feeling, rather than I am the thing that's happening to me. I'm recognizing something's happening to me. And we're now in a deep conversation about that, which is a psycholytic dose. And so over time, you get used to what medicines have what dose range, where you're psycholytic. Let's say psilocybin, you're 1 to 2 grams, and then you go toward 3 to 4 or 5 grams is psychedelic. But each person, of course, is different. Their metabolism, their ability to process and remain. I have a lot of first responders who on high doses can still keep control. And that's a defense. It's a great defense while you're out on a field in a call, but it's one where they're not willing to let go of their control. So they're not quite doing the work they want to be because they're still scared of letting go. So they might be on a psychedelic dose, but still a psycholytic mind frame. Very interesting. Kyle, do you want to add to that?
Yeah, and I guess I'll say that, you know, in the early years in Europe in the 50s and 60s, psycholytic therapy was more prevalent. And it seems that now the research is really focused on more high dose mystical experiences. But I do think there's a lot of potential here. When I was working with ketamine, I seemed more in the psycholytic dosing. And there was a lot more kind of conversation that would happen sometimes with clients, a lot more kind of somatic work that would come up. And so, yeah, I'm hoping that the field can start to explore this aspect a little bit more.
Mm-hmm. For me and for all of you to realize, when we were asked to do this, what Kyle and I want to do is help create conversations about where the field may be going, where it could be going, where it should be. Who knows should, but let's just say may and could. I'm a trained clinical psychologist. I'm a Buddhist psychologist. I have a very specific way of working. Why waste my skill set? And also my mind frame is some people come to me, 40, 50, 60, even 70, 80-year-old folks are coming to me and they haven't figured some things out yet. The medicine alone, does it give you everything you need? Does it actually help you understand what you're seeing? Of course, insights are coming. Of course, you get revelations. But Is that alone going to help somebody really shift or do the healing work in session or help them grow? Or is there something I can do as a facilitator, as a psychologist, as a healer that will help use the material coming up in session to get to their deepest healing or to help them with growth? So my perspective is I'm going to be using my skill set a lot more directly than some folks who are like, I just want them in the medicine to work. Well, I believe, I'm going to be helping them. I want them to be helped. That's my goal. That's my job. Kyle, what's your philosophy on that?
I come from this Groffian, holotropic transpersonal breathwork background, and it's been really ingrained in this non-directive approach. And over the years, I have been learning that I think sometimes it is very important to be a little bit more directive at times and bring your expertise into the room. I think there are a bit of these nuances and the reason why we wanted to have this conversation today. I'm going to maybe just switch and maybe just give a little bit of a background, because I was seeing in the chat that some people maybe don't know what the, this non-directive, inner-directive approach is. And it'd be good to just maybe go over some of this stuff, and then we'll open it up for some Q&A. So when we think about this non-directive, inner-directive approach, there's lots of different kind of names that I've heard over the years. I've heard Michael and Andy Mithofer even call it self-directed. There's a lot of playing around with the words. But when we look at, say, the MDMA-Assisted Psychotherapy Manual, really the foundation for this manual and the psychedelic-assisted psychotherapy approach was laid by the Groffs, Leo Zeff, George Greer, Raquel Tolbert, Metzner, and many others. And this non-directive approach really includes an empathetic rapport and presence. There's other aspects to this manual and protocol, but for this, we really wanted to focus on this inner-directed, non-directed approach, and really emphasizes invitation versus direction. So maybe using the phrases, we encourage you to, this might be a good time to, and instead of say breathe, maybe we're saying breathing. So it's more suggestive than rather directive. And then also reflecting back to the participant when there's what they're saying in order to continue the conversation without being directive. So this is directly from the MDMA manual, and this is how they're starting to define this non-directive approach. This concept of the inner healing intelligence, this was really kind of put forward, coined by the Groffs, and it also is one of the tenets of holotropic breathwork and Groff breathwork, transpersonal breathwork. And what Groff started to notice when they started to develop this technique was that the psyche had this innate wisdom to move towards wholeness. And so for those that don't know who Stan Groff is, he's one of the pioneers in LSD research, got started in the 50s, 60s, over in Czechoslovakia, came over here, and then when everything became illegal, they ended up developing holotropic breathwork at Esalen with his wife, Christina. And so we don't have any substance involved in this, but still the psyche kind of knows where it's going when you're using breath to amplify these states. And so again, here in the MAPS manual, it's saying it's essential to encourage the participant to trust his or her inner healing intelligence, which a person's innate capacity to heal the wounds of trauma. It's important to highlight the fact that the participant is a source of his or own healing. So really the participant, the client, is they're the expert in their own experience. And we're starting to see some of this language be drafted up. I think I know Colorado also has an emphasis on this non-directive kind of inner healing approach. And most of the psychedelic-assisted psychotherapy models are really focused on encouraging the client to go inward and really stick with their internal experience rather than, focusing on the external experience and having more of that feedback. So again, the client and the participant is the expert in their own experience. They know. And I just came across this article a few months ago and realized, whoa, there's actually an article trying to define this inner healing intelligence. And I understand that the inner healing intelligence, some of the language there can sometimes maybe be triggering for folks. And so again, we've heard lots of different terms, whether it's the higher self, say in like IFS, some people use psyche, inner wisdom, lots of different ways. So this was combined with the escitalopram study that came out of where was that, Imperial. And so they randomly assigned 59 participants diagnosed with moderate to severe depression. The psilocybin group received high doses of psilocybin 3 weeks apart, so 25 milligrams. And they've also received a daily placebo after those sessions. And then the escitalopram therapy, they received 2 placebo doses of psilocybin, and then their medication for 6 weeks. Both received psychological support. But the participants were asked to complete an assessment called the Inner Healer item. And so they had to answer whether they strongly agree or disagree to the statement, I felt like my body, mind was healing itself automatically, naturally, and by itself. And for those that are familiar with Michael and Annie Mithofer and the MDMA studies, you might have heard Michael use this analogy when he worked in emergency medicine, that the body knows how to heal. When he was working, he always made this analogy with a cut, as a physician, doing the stitches is really just creating a container for the body to do the healing. As a doctor, he wasn't doing the healing, the body was doing it. It was just creating that container for the healing to happen. And so that is kind of like the idea around this inner healing intelligence and this non-directive approach. And so some of the results there were that the participants who received the high dose of psilocybin reported significantly higher inner healer scores compared to those who received a placebo. And then the higher inner healer scores were associated with more significant reductions in depressive symptoms 2-week post-dosing. And then the participants reported higher inner healer scores experienced more significant mental health outcomes, regardless of the self-reported intensity of the psychedelic experience. So it's pretty interesting that there is some correlation there around this idea of this inner healing intelligence. But there are some critiques, and some of those critiques were that the results might have been skewed because the study focused solely on the patient's perspective during the medicine sessions. It didn't ask the escitalopram group about their inner healing experience throughout the therapeutic protocol. And then additionally, according to the research team, the study did not empirically prove whether the inner healer feeling is intrinsic, quantifiable by neural mechanisms, or an event caused by subtle therapeutic guidance. And some other critiques. So the concern around the scientific validity, coherence, and the mystical undertones. So maybe when we're talking about this inner healing intelligence, there's, a lot of that maybe spiritual talk involved in that. And, some people do have concerns. Should we be including this in research? Should we be including this in some of the, the way that we're showing up? The healing mechanisms attributed to unexplainable subconscious forces that may oversimplify complex psychological processes, leading to pseudoscientific woo-woo practices. Contradictory nature of self-led process that requires significant intervention from a therapist and the hallucinogen. So it's like an interesting thing. If we do have this, innate wisdom to move towards wholeness, why do we need a therapist or psychedelics to create that? And I think the argument there is sometimes we can't access that ourselves. We need other tools. We need other people to maybe mirror that or create that container. And then Brennan and Belser are saying the treatment benefit is brought about the guidance of an inner healing intelligence, though based on clinical wisdom of experienced practitioners, has yet to be subjected to empirical scrutiny and may represent another avenue for the introduction of therapists' personal beliefs about the treatment. So again, could this be an opportunity for people to really impose spiritual beliefs during treatment or clinical trials? And then as I mentioned, language can really matter for some folks. Sometimes when I've talked about the inner healing intelligence, Some people are really turned off by it, might feel too spiritual, too woo-woo, and it doesn't really resonate. So, are there other terms that we could potentially use there for this mechanism, this idea? So I wanted to just bring up some maybe limitations based on some of my experiences, and this is my last slide, and then we'll talk more about this directive approach that Mike is bringing. So, something that has come up over the years is that I started to hear that people don't sometimes always trust themselves. It's really hard to really trust ourselves, right? And so I remember I had a client when we were doing ketamine therapy, and we were talking about this inner healing intelligence and to really trust. I remember they said, how can I trust the universe or myself when I've been betrayed nonstop? And I've heard that a few other times from another client who had, a distrust in their body. And so, what happens when people don't have that innate trust to listen to what's going on? This can be really difficult at times, but I also think that's where maybe the magic and the healing does happen, and it can be a very slow process to start to build that trust. But, are there times when we are maybe a little bit more directive in these approaches when people are really kind of questioning that trust? And, I've noticed it too in some of my own training. I had a teacher that was very non-directive, and I mean, it would drive me crazy. I'm like, just tell me what's going on. I'm coming to you because I want to know something, practice, this and that. And he would just say, and I would get so annoyed. I'm like, but I don't. This is why I'm coming to you. But over time, I realized that, this person was trying to get me to believe in myself and have that agency to trust. And that can be really, really tough. But I also think maybe where that healing does happen, even though there might be some frustration there. Sometimes people really don't know what they need. Sometimes they need a little bit of direction, right? People get confused. And as I said, just in my own experience, like going to somebody because I feel like I need something for somebody to either mirror back to me, to tell me what's going on. And again, I think that comes back to the trust. And, I see this in breath work a lot because the transpersonal breath work that we come from, very non-directive. We don't give that much instruction. We just say, amplify your breathing and follow the process, follow those inner cues. And sometimes people get really caught up on, well, there's got to be a certain breathwork practice that gets me there. Maybe I'm doing this wrong, right? And so we get really tripped up, I think, in really trusting ourselves. I think directive approaches can be really critical when clients are testing boundaries. So for example, there was somebody, as they were coming up on ketamine, really confused where they were, and they were confused who I was, and they were asking me if they knew me, if they could trust me. And there was a part of me where I said, this could be a really interesting, thing if I said, well, tell me more about that, or like, why don't you trust me in this moment? But realizing this wasn't the time to take that type of approach. This person, I could feel they were really kind of like, nervous. Something was coming up from them, and had to be very direct and said, no, yes, you know who I am. We engaged in this, this ketamine therapy, and, really went over the boundaries again, and were more directive than versus trying to be maybe more self-reflective and trying to get the client to explore why that's coming up in that moment. You could tell that there's a lot of fear and anxiety that was coming up. And I think they really needed a more direct answer than something that could potentially, I don't know, it could potentially have them spiral out, create more anxiety. And then with the inner-directed approach, this kind of really hands-off, sometimes it's not knowing. As a sitter, a facilitator, we're really trying to trust this inner healing intelligence, but sometimes there's this ambivalence of not knowing what's going on, right? And so that can create a lot of anxiety in the client and therapist. So what happens when the client doesn't fully trust this inner healing, non-directive approach, they want to do something, people can really pick up on that. And it can create that transference, countertransference loop, anxiety. And so, how do we really trust that? Or trust in, maybe I need to be, a little bit more directive right now. Maybe I need to, know instead of sitting in this not knowing, or sometimes what we call in this technique, doing by not doing. So not intervening, not doing anything. But that can create a lot of anxiety for some facilitators. What do I do right now? How do I do this? Do I really trust this process? It's kind of giving me anxiety, right? Clients can start to feel that, or participants can feel that. And then also, what if the client's asking for something that the quote unquote like inner healer or the plant medicine is asking of that doesn't seem appropriate? Maybe could be harmful, right? Sometimes people get a lot of downloads. They say, oh, Mother Ayahuasca is telling me this, the mushrooms are telling me this. We have seen in, rare cases, but extreme cases where people sometimes become violent, maybe they try to self-harm, things happen, maybe because they get that message, right? Is that a time to not trust that inner healer, but to be a little bit more directive and intervene at that point? But I think at the best, this non-directive approach can really help to cultivate agency within the participant, right? Like really having the person trust in themselves, believe in what's going on without a lot of intervention. And, when can intervention be triggering? We had an example where during a breathwork workshop, somebody just did something very parental, motherly. They put a blanket over somebody because they thought their feet was cold. I mean, that really triggered them, brought up all this stuff. And, if something is like, oh, we thought it was just going to be something nice and motherly, actually brought up a lot of stuff for them. I remember when I was having a session with a ketamine therapist, and I was really going inward doing my work, and they interrupted me to ask me a question. And I'm just like, why? Why would you do that? I was really in it. And so, I think at the best, yeah, sometimes these inner directed approaches can help really foster agency in one's own healing instead of projecting it out onto the healer, the therapist, and really kind of starting to own that. But, are there limitations, and can this approach evolve? And so I'll pass it over to Mike to, expand on that a little bit more, because I know he has some case studies and some thoughts about this.
Well, I was just listening so deeply. I have no idea what I'm supposed to say, but all right, here's my deal. So I lead retreats, which means I'm definitely hands off on retreats. You might have 12 to 16 people, and they're all doing inward stuff. And I know the medicine's working within them. And the medicine shows them images of their childhood or difficult parts of their life that have impacted them. And then they come out and they go, I can see it, but I don't know what to do with this stuff. Like I'm so glad I got to observe, and I know maybe I gave myself some love, but I don't really know what to do knowing that I'm programmed. My job as a psychotherapist is when I'm working with people one-on-one, and that stuff is arising. So they have images of difficult childhood memories, or they have their memories of difficult childhood experiences, or they see their programming very clearly. Like a father said something to me that I don't have worth. And then that's when I started having this all like, I don't believe in myself, which is cascaded into my whole life. That's what most people come with. Their depression really turns out to be, I was told I'm not really worth anything, or I don't have many skills, or I'm not intelligent. And that thing has impacted the way I see myself, the way I relate to people, the way I work, the way I function. But they don't know what to do with that. They go, I'm great, I'm glad I'm seeing it, but now what? So what I've been doing for many years now is helping people create a relationship with themselves in the moment while they're on the medicine that is supportive, encouraging, loving, compassionate, tender, wise. What do you want to do with yourself? That part of yourself, that part of your psyche, that part of your personality. What do you want to do with that in the very moment? That can be healing. That can also be growth oriented. So I started developing a kind of a way of being or protocol with my patients and clients, where they start doing things that are active, that are progressive, not just like understanding, but actually doing the healing themselves. Because I do believe everybody who comes to me has their own answers. They might not know what they are. They might have repressed them. They might deny the answer, which is why my work is called truth medicine, because I truly believe that the truth, speaking your truth, getting to the truth, is what helps heal people. Stating the truth, being clear about your truth. And so I do have a perspective, I do have an orientation as a therapist that I'm bringing in. I actually want to show you my orientation. I'm going to, oh, it's a new, here we go. Oh, I don't know how to share. It's a new computer. That's too bad. Here we go. Anyway, so my orientation and what I believe is that truth and unconditional love are the medicines. The substances might be ketamine, psilocybin, MDMA, 5-MeO, ayahuasca. But what actually heals people is unconditional love for themselves that they learn to apply to those parts that are wounded, and also truth. So when they start speaking and acknowledging their truth, things shift inside themselves. So my job is to help them. What I see as my job is to help them get to that place so that not only they recognize, oh, I had these experiences that impacted me as a child, and that impacted the way I see myself in the world and the way I relate to people, but that I actually want to help them do something about it in the present moment. I think that piece is missing in our field. I think the piece that we teach or lead or help facilitate, which is definitely more directive than just exploring through questions. Well, explore that more. What do you think that, well, even that's directive. What do you think that kid in you needs right now? If that child had a voice, what would she say right now? How would she express herself? These are kinds of questions that I start to use to get deeper and deeper into them having a healthy, caring, nurturing relationship with themselves. So I'm not just like, explore that, tell me more. I'm actually helping them, one, follow the thread, find the core wounds, and then I'm helping them, what do you want to do about those core wounds? Sometimes they don't know. And I say, well, would you ask that kid in you? What would they need in this moment? Well, I need to be cared for. I need to be held. I was just hurt. Why is no one hugging me? One of my cops, when he was 15, his dad died, and not one person hugged him. His mom immediately got 2 jobs and couldn't focus on the kids, and they were left to themselves. He's a 56-year-old retired detective who doesn't know how to tend to himself. He won't let himself cry, and he has no idea what to do with himself in retirement because no one ever helped him access himself as a teenager. He was left alone. And so now he has no idea how to be with himself, tend to himself, encourage himself. So we're going back to the 15-year-old who lost his father, and I'm helping him become the parent he needed at that time. I'm giving him the skills how to be tending and nurturing. I'm also helping him discover his creativity, which no one helped him bring forward. He had no mentors. So this is more of a directive approach, but it's still within him that I'm helping him find himself. I'm not doing it. I'm just giving him the methods for doing it for himself. But we don't have enough of this training in our field yet. And all of us and all of you who are looking to do more work, and especially if psychedelic psychotherapy becomes billable, what are you going to be doing? So some of you might be learning IFS, some of you might be just somatic experiencing, you'll have an orientation and framework. I offer a very particular style, but if this is becoming mainstream, we have to know what to do more than just presencing, because there's going to be more opportunity to do this kind of work. If you're a therapist, you're going to want to do your therapy while people are on medicine. But that also means you have to learn to discern when to be quiet, when to watch, when to ask just non-leading questions. Tell me what this experience is like. So my work is much more directive in that way. And this is what I'm teaching my students, to use their intuition, to use their skill sets, to intervene appropriately, to be quiet appropriately. And that takes skill, and that takes time, and that takes mentorship, guidance on our part. So I think I'll leave it at that. That gives us some time to kind of ask Kyle and I questions and go deeper into that.
Yeah, it looks like Allie had a question for us. How do you know if the directive approach is landing well with the client?
Should I speak to that, or you want to go?
Sure. Yeah, you can go and then I'll jump in.
I love it. I love it because they have told me that doesn't seem right. I'm like, awesome. What does seem right? I have made so many mistakes also out of my own Oh, I think I have many intuitions. You know, I had this intuition. This is important from one of my dudes I'm working with. But I also had the feeling it's not the right time, Mike. But I didn't listen to my own intuition. And I said the thing, which is true, but not the right timing. And the dude got really angry with me. He's like, I really want to hurt you right now. And I'm like, oh, dude, I can see that. And I'm so sorry. What just happened? And he was able to tell me, even though he's on ketamine, I was able to tell him, and we repaired in the moment what I had done that ruptured our relationship, which is valuable, and I own it as a clinician. And there are most of the time I see people very clearly going, that doesn't sound or that doesn't feel right. And I'm like, great. What does feel right? What is more right for you? And then they'll explore themselves. And I'm like, good for you saying no and saying what is true for you. That's how I've worked with that.
Yeah, thanks. Thank you for that. I'm gonna maybe use another example of like, maybe where I was questioning the non-directive approach. I had a client that was looking like they were feeling very, very sick on ketamine. And, I'm thinking, okay, this is like part of their process. I'm watching them kind of stick with it, breathe. But there's also this like, it seemed like they were really kind of struggling. And so, trying to ask like some non-directive questions, not getting much. So I'm like, okay, maybe this is part of their process. I think they ended up getting really sick afterwards, but I pulled back and thought, was that the right approach? Should I have actually intervened a little bit more and been more directive instead of like, letting this person kind of struggle? It didn't, when I followed up with them later on, it didn't seem like it was so terrible, but it was also like a little, they were going through this like just nauseous feeling the whole time. I mean, you could really see it. And so that had me question that approach a little bit more, going, yeah, like maybe there should have been a little bit more like intervention and direction there. There's times when I see this in group work where, say, when I think of some of the directive approaches, we can say like neo-shamanic techniques or folks that like have practices in energy medicine, where they really feel like they know what's going on with somebody, and they might pull out some sage or smudge. And I've been in groups where, the facilitator might be feeling more anxious and saying, oh, this person is having like a bad time, or there's like bad energy in the room. Let me go smudge them and do X, Y, and Z. And I have seen that really trigger people where they're very sensitive to it. They're like, get this out of my face. What are you doing? And so I think we do have to also be kind of careful when we're doing physical or energetic directive interventions, because sometimes we don't always know. I always appreciated this story that my teacher Lenny shared. I might be in the Holotropic Breathwork book as well, but in breath work, sometimes we intervene with body work, a supportive process to help somebody express their experience. And there was a facilitator that saw somebody curling up in the fetal position. And in that model and framework, we talk about these basic perinatal birth matrices, so how the birth process really impacts our psychology. And so one of the facilitators comes over and starts to coddle them and tries to push them through the birth canal. During the group share, the person said, I was a Viking warrior dying on the battlefield. It's like sometimes we think we know what's going on with folks when they're deep in those experiences, but sometimes we have no idea. And I think that is an important perspective to hold, and where that non-directive approach can be really important and helps us sit with ourselves. Why do we want to intervene right now? Why do I want to be directive? Oh, I might be noticing I'm feeling anxious, right? When I was saying like that ambivalence of sitting in that not knowing, I don't know what to do right now, right? Like this big energy is coming up. I'm feeling anxious. Like, maybe I'll do X, Y, and Z to, help me with my anxiety and fears. And sometimes that can cause harm to people, right? People come out and say, why'd you do that? If we, look at some of the critiques that have happened in some psychedelic therapy sessions or in other, say shamanic containers, group containers, that's where harm happens, where maybe the therapist or the guide wants to intervene physically or something like that because we think we know what's going on with somebody. And so it's this fine balance. And how do we use intuition and I think our experiences? And I think this is where like having our own experiences can sometimes be helpful. We don't want to completely lean on that, right? Because then we can get really biased and think, oh, yeah, everybody's so different. But yeah, this is a very kind of nuanced thing.
When I'm training people to do this approach, first of all, I take journey notes for all my clients. I'm actually typing out what they're saying and what I'm saying, and they take it home with them and they reflect on it. It's not all the time they can remember every part of our conversation. So I'm really cataloging what they're saying back to me, the questions I'm asking them. But when I'm training people to do this kind of more directive approach, more engaged approach, I would say, I have my students have a journal for the meta process, and they're kind of also cataloging a little bit of like what's going on for them. Why did they say this thing? Why did they do this thing? When I have permission to film myself and my client, or my students and my client, then we can look, of course, and watch why did you say that right there? How did that feel inside yourself? Was that you, like when I made my mistake, I knew it was a truthful thing, but I also knew it wasn't the right time. So why did I do it right there? What pushed me to do that thing and create a little bit of harm between us or hurt him? So I had to go back and really sit with that and look. So I do that with my students. They're kind of looking at themselves as they're doing this. What's prompting you right now to say these things? Versus sitting with, or did you see what you missed here, or could you have done something different there? And these are nuanced skills that we build over time and hopefully get good mentorship and direction, just like we would with any of these programs, in our trainings. So yeah, we just want to bring this to you all, thinking what more will be happening in our field, and what training, what kind of consciousness do we need when we're going to be be with people in this kind of vulnerable place.
Yeah, so I was just going to pop on and ask if you could spend a few moments talking about the Vital Training Program, and what does the trajectory look like if you're going to be a student to establish these skills that you've been describing.
Yeah, thank you for that. Yeah, so Vital is a 12-month program. We go over a lot of harm reduction skills, talking about navigating the psychedelic experience as a client, also as practitioners. If you're sitting with folks, talking about these very nuanced conversations around non-directive approaches, directive approaches, the ethics of it, and then a really big focus on integration in our own inner work. So we have some modules on inner work. We really kind of have this focus on that because we really believe this work really starts with ourselves. We believe in the theoretical and didactic pieces, but really, I think a lot of this starts with us. And so we really build in these inner work components as well. So people will get experiences doing role plays. We have smaller breakout groups where we can have these very nuanced discussions in class. And yeah, really learn these psychedelic informed practices on harm reduction, integration, and also ethical space holding. Yeah, Mike, I don't know if you wanted to add anything there.
Yeah,
as
I
well.
love it. We're on our third or fourth cohort starting soon, and I think so. Y'all meet once a week and get an awesome lecture from experts all over the world, and then we have small groups that meet every week. And I'm both a lecturer and I'm a small group leader, and that's where the small groups are the most precious, I think, because that's when you get to really how do you integrate what you're learning, both personally and professionally. And the small group leaders are very versed in different styles like IFS, SE, Buddhism, non-duality, indigenous practices. But we're really giving space for the students to kind of come up with what's right for the student as he and they grow throughout the year. Yeah, Vital, I love it. Out of all the things I've seen in the country, all the different programs, I think we have an awesome breadth and depth both of topics, and it generates kind of a strong community family feel, which is important.
Awesome. Thanks so much for sharing that. Also, you offer experiential part to this training?
We do, yeah. We require an experiential elective where people can go and have an experience, whether they're finding it themselves. If you want to go to a retreat that calls to you, we've hosted our own breathwork retreats where people can go and get that experience sitting and being in the room with people in non-ordinary states. Our retreat requirement has shifted a tiny bit over the years, just hearing a lot of student feedback and trying to make it more accessible. So we still have that part of it, but trying to make it a little bit more accessible, and people can find some of their own retreats as well to attend to. But yeah, we think that having your own experience, whether it's having your own medicine experience, breathwork journey, and also being able to have that experience sitting is a really important part of the training. A lot of unlearning, I feel like, happens during those times.
Absolutely. There's a question here from Nick who's asking, he says he knows that you have 5 modalities: spirituality, microdosing, business, and which would you say is most geared towards being a better guide?
So yeah, Nick, it looks like you're talking about our specializations. So during our curriculum, everybody will get the same core curriculum. And then as you're pointing out these modalities or specializations, this will be a specific focus. So I think I saw somebody else ask, do you need to be a licensed therapist to join the program? And one reason why we've kept Vital pretty inclusive and open is because we've always operated from this harm reduction perspective. We realize people are out there doing this type of work, whether you're in an area that's decriminalized. We're seeing different states change their qualifications. Say if we look at Oregon and Colorado, where you don't need a clinical license. And so the question has always been, where do people get these types of training and education when they don't have a license? And so that's why we've created a more kind of an inclusive model. So with those specializations, as you mentioned, there might be, we have the business and regenerative leadership specialization track. So we do get people in our program that are trying to make some shifts, and maybe they're thinking about, how do I create a business, right? We do have graduates that went on to create psychedelic businesses in all sorts of different kind of areas. And so that might want to be a focus for some people. The other one is on spiritual emergence. So for those that want to focus on what happens when these experiences get really big and we'll say like maybe a little bit out of hand, where people are opened up too much, right? So be able to learn about how to support people through these spiritual emergence processes. So the specialization track will just be a focus within the larger program. And so you'll write a foundational paper why you want to explore this track, why you signed up for it. And then your final project will also be focused on that specialization. And then you'll take elective courses that are also focused on that. So it's just one avenue in the bigger program to give somebody an emphasis and specialization in a topic.
Awesome. Thank you. So there's a couple more questions in the chat. So we have a few more minutes. Someone's asking, where is Vital located?
We are global. Our company is based in Colorado. We're a Colorado company, but we're pretty global. We have students from all over the world. We've had students from Thailand, Lebanon, Switzerland, Belgium, all throughout Europe, and the States, Central America, South America. So yeah, we have people from all over the world join.
Great. Another question here is in regard to, are there BIPOC practitioners, trainers as part of the Vital team?
Yes, and then we also have a BIPOC Affinity group for those that want to join those groups as getting extra support, and that's peer-led. So we have some of the students leading that group as a space for people to join. But yes, BIPOC practitioners and trainers as part of the team as well.
Excellent. And is there scholarships available for marginalized communities?
We do, yes. We do offer scholarships. So if you're interested, you could fill out an application and then our scholarship application. We've given out a pretty hefty amount of scholarships in the past 3 cohorts. We do believe accessibility is important and understand that this is a big investment money-wise and also time-wise. And that is the question that I think a lot of people in the psychedelic community and field are thinking about. How do we make education and training more accessible, and also these treatments, right? We know that it's going to be expensive right out the gate, and so that's always top of mind. How do we make this more accessible? So scholarships we do hand out.
Yeah, absolutely. And, I think it's important to think about when you do a training as comprehensive as this, is that it's an investment into your career and to be able to expand your practice in ethical and comprehensive ways. So in that way, it's similar to maybe undergoing a program at a university or more advanced training.
Yeah.
All right. Well, thank you so much. We appreciate everybody's time for being here, particularly our two guests. We will be sending out a follow-up email with all the links shared, and we appreciate the knowledge shared. So thanks for being here.
Awesome. Thank you so much for having us, and thank you everybody for joining.
Thank you all so
Okay.
much.
Thank you. Have a good day.
Take care.